So how did the Federal Tort Claims Act apply to you? How did you get involved in it? In 1992, Congress passed the Federally Supported Health Centers Assistance Act. Congress, for whatever reasons, believed that health centers were paying more in malpractice premiums in the late 80s than insurance companies were paying out in losses. That may very well have been true. There was also a number of areas in the country where health centers were having a difficult time just finding good malpractice coverage. South Florida, South Texas, Chicago areas were difficult at that time for health centers to find good comprehensive malpractice coverage. So you had two issues working: the ability to find coverage and the cost of the coverage versus the payouts. So Congress passed the Federally Supported Health Centers Assistance Act in 1992. And that act said that the Secretary of HHS has the authority to deem health centers to be federal employees. Okay? And they can be considered to be federal employees, and as a federal employee, be protected by the Federal Tort Claims Act. This protection only applies to medical malpractice suits. So you're not considered a federal employee for everything that you do. It's only if someone makes an allegation of medical malpractice that you become a federal employee, okay, and have the protection of the Federal Tort Claims Act. You have to have that allegation to trigger the act and get the protection. So once that occurs, the plaintiff's only remedy is to file a claim under the Federal Tort Claims Act. It creates an immunity from liability for the employee, you. Yes, sir.
Question. For example, if someone's complains of discrimination, like you're a racist or something, it's not covered?
No. The question was if somebody accuses you of discrimination and makes perhaps a Civil Rights Act complaint.
Whether giving appointment, something, they have something medically related, like they didn't get an appointment, something, and they come back and say, well, you are discriminating, this, for those
yeah, whether or not a claim is covered really depends on how the plaintiff casts the claim and how they describe the claim. Let's give you an example. If a plaintiff argues that you violated the ADA, Americans with Disabilities Act, because you didn't have a sign language translator, a signer with my deaf child in the room, that would not be covered because that's an allegation of a violation of the ADA. But if this, in the same situation, the plaintiff says, oh, you were negligent in the delivery of medical care because you didn't have someone who could translate for my deaf child, then that's an allegation of negligence, so the FTCA probably would cover that. So much of it would depend on how the plaintiff's lawyer casts the claim and what he wants to do. I think if they cast it as a discrimination complaint, they're probably just making a mistake, not realizing that they're going to miss out on going after the United States. So they may very well recast that complaint once they find out what they've done. Okay. This program, you could probably make an analogy that this program is very similar to an occurrence malpractice policy. If you were able to find and purchase an occurrence malpractice policy that had no limitations whatsoever in terms of dollar amounts, that would be pretty similar to what you're getting here. And if you could find it and it was free. So if there's a free occurrence policy out there with no limits, that is a very good analogy to what you're getting under the FTCA. The program's been around for 16 years since the first claim was filed. And it's pretty successful in terms of the coverage provided and the savings to the health centers. And we can talk about that later, too.